One of the other kind of potential combination pathways for treatment of myelofibrosis, which we've been interested in for a long time, is sort of targeting epigenetics. And so HDAC inhibitors, such as panobinostat and others, Panobinostat, Givinostat, for example, have been studied. And we've recently published a study which we began, oh gosh, probably a decade ago, combining panobinostat, which is an agent where there is some data for its use in myelofibrosis, but not very robust, and ruxolitinib. And in this study, we did find good efficacy, and we found a small subset of patients who were able to continue on the combination for well beyond 5 years. But we also did see quite a bit of toxicity in terms of expected side effects, so worsening fatigue, anemia, etc. So really interesting data and some big lessons for people who, as we take forward combination studies. And some interesting effects, but not one that's going to be taken forward real time, I don't think. But I think also, just demonstrating commitment to publish studies, even if they're kind of not negative, but, not strong enough to take forward into a phase 3.